Hi, everyone. I'm Dr. Swanson alongside Dr. Fontana. We're from KSB Foot and Ankle Center. I'd like to first thank KSB Community Wellness and Aaron Fox for putting this presentation on this evening. What we'd like to do is discuss heel pain. A lot of us experience heel pain, and as providers, we see this condition on a daily basis. And so we'd like to go through a few conditions, maybe give you some tips that you can pick up, and hopefully either help ease some of the symptoms you're feeling and prevent any pain going forward. So some of the topics we're going to cover include plantar fasciitis, Achilles tendonitis, bone spurs, stress fractures, and then overall body alignment. So first, plantar fasciitis. The plantar fascia is a ligament that's on the bottom of the foot. And plantar fasciitis typically presents with pain after rest or with being on your feet for longer periods of time. Especially when you sit or get up in the morning, you get some extreme pain in the bottom of the heel. And in that image where you can see it's red and inflamed, is typical area that patients will say they're having pain at. There are multiple causes for this condition, one being overuse injury. There can be a single traumatic event that causes it. There may be a biomechanical source that we need to address. Any change in shoe gear or activity can also spark plantar fasciitis to begin. So like I mentioned, pain can be first steps in the morning after activity, and sometimes it can get so severe that you are not able to bear any weight to that extremity. The location of the pain is typically the bottom of the heel, can be along the arch as well, and you may even experience some pain on the outer aspect of the foot or even the other foot because of compensation that your body is trying to adjust for the plantar fasciitis. So what are some of the treatments? Well, stretching is the number one most important thing to keep in mind. If we can keep our muscles and tendons nice and stretched out, that's going to really help ease the tension along that plantar fascia. Physical therapy can be very helpful, and we are fortunate at KSB to have a very excellent physical therapy department. RICE therapy, so rest, ice, compression, and elevation can be helpful, and also modifying or decreasing activity for a period of time. And then supportive shoes and inserts. Inserts really help support that arch and that plantar fascia that's on the bottom of the foot. If conservative treatment fails, we may need to progress to surgical, which involves release of that plantar fascia. The next condition is Achilles tendonitis, and this is pain along the Achilles tendon that's on the backside of your heel. It can be classified into two different types. There is non-insertional, which is the tendon above the level of the heel bone, and the most common area for pain is called the watershed area. Then there's also insertional tendonitis, which is where the tendon inserts onto the heel bone. A lot of the time, a tight Achilles tendon is the main source of Achilles tendonitis. A tight Achilles is the most deforming force of the entire foot and ankle, so that can make a lot of conditions worse. Some of the symptoms can be pain with first steps after sitting, just like plantar fasciitis, pain with activity. Some other causes, overuse injury, a single traumatic event can also begin, and biomechanical source as well. So the treatments for Achilles tendonitis, you'll kind of see a repetitive cycle on what we recommend, and really these things can help everything get improved. So number one, stretching. Two, physical therapy. Heel lifts are especially important for Achilles tendonitis because that will decrease the pull of the back calf and Achilles tendon to allow the inflammation and pain to decrease. And then we progress with stretching after that time period. And also supportive shoes and inserts. All right, now I'd like to turn it over to Dr. Fontana.
Thank you, Dr. Swanson. My name is Kara Fontana, one of the first-year residents at KSB's Foot and Ankle Department. So I will start by talking about bone spurs. So it can be an increase in bone growth. In this picture on the right, you can see that at the back of the heel bone, on the bottom and at the top. So this can occur from pulling of the heel bone from either the plantar fascia, which would cause that bone spur on the bottom of the heel, or from the Achilles tendon pulling at the back and the top end of that bone. So if they do cause pain, there are conservative treatments, like Dr. Swanson said, with Achilles tendonitis and plantar fasciitis. Stretching is very important for this as well, along with rice therapies. We can also try offloading pads to help decrease pressure on those areas, and supportive shoes and inserts can be helpful as well. If none of those work, there is surgical treatment, so we can remove the spur. On this picture on the left, you can see an increase in that bone spur on the back and the top of the heel. And then on the right, this has been taken down and the Achilles tendon has been repaired. Next, I'll talk about stress fractures. So this is pain within the heel bone. This can be caused by an overuse injury, a traumatic event, or from a biomechanical source. And some symptoms are pain with walking, pain with pressure on that heel bone, and a calcaneal squeeze test is how we usually check for it. So that's just putting pressure on the in and outside of that heel bone. So in this picture on the right, where that heel bone is bright white, that tells us that there's likely a stress fracture there. So treatment. The big treatment for this one is immobilization. Being non-weight bearing and letting that heel bone rest is very important. So we can do that with a cast, a splint, or a walking boot. A lot of times this does require an MRI evaluation to see the full extent of the injury. And typically the bone heals within 4 to 6 weeks. Vitamin D is a great supplementation to help increase that bone healing, and rice therapy with anti-inflammatories is also very important. Next, I'll talk about body alignment. This is very important. We evaluate it from the feet all the way to the head and also do a gait analysis. So if one part of your body is imbalanced, this goes all the way through your body. There's a chain reaction that can be present, and this can cause increased pain at your feet, knees, hips, and the symptoms can be prolonged. So in that picture on the left, the body is imbalanced. And then on the right, that person has a pair of inserts and it's helping them get their body in better alignment. I will pass it back to Dr. Swanson and he will review what we've gone over today.
Thank you, Dr. Fontana. So in conclusion, heel pain is a very common condition. We see it on a daily basis. Remember, there are multiple causes of heel pain. And in regards to the treatments, stretching most often is going to be the most important thing that we can do. Don't underestimate supportive shoes and inserts, rice therapy, and earlier diagnosis equals earlier relief. So we hope that you enjoyed tonight's presentation. If you are experiencing any heel pain that you're having difficulty getting resolved, we'd be more than happy to see you and help you with that. We'd like to thank KSB Community Wellness once again for this evening, and we hope everybody has a fun and safe fall season and happy Halloween. Thank you and have a great night.